World Health Organization, the death rate from cancer is expected to rise by 75% by 2030. Today on Sound Health, our focus is on the role of vaccines in cancer prevention. I'm Olasumbo Modupe. Welcome to the show. Sound Health on Lagos Television. This week, the world observed Cancer Day with a call for personal commitment to reduce cancer scourge in the world. And today we are looking at the role of vaccination in cancer prevention. I have with me Dr. Oduayo Talabi, the Managing Director of Pretty Healthcare. Welcome to the show.
Thank you for having me.
Okay, to start with, what is the relationship between HPV and cancer? Oftentimes we hear HPV and people still don't know the meaning of HPV. What's the relationship between HPV and cancer?
The human papilloma virus is what they shorten to HPV. It's a cancer of the reproductive tract commonly. The relationship is that it infects women and of course men, but it causes cancer in women. And why is this important? Because the cancer it causes is the second most common cancer of women, that is cancer of the cervix. When you hear HPV, why is it important is that it is linked to almost 80% of cervical cancers. And this is a vaccine preventable infection. So the link is, if you prevent HPV, you are as well preventing cervical cancer. So that would be the relationship between the two.
In this part of the world, which is the most commonest cancer? Because oftentimes we hear breast cancer, cancer of the lung, and cervical cancer.
Really, that's for women now. We are focusing on women because you have to be a woman to have a cervix.
Okay.
Men don't have. So, number one, cancer of women is breast cancer, actually. Number one in the sense that it's more common. But cervical cancer kills more because it's more silent. Let me put it that way. It's very silent. The infection comes in over time, it grows, it changes the cancer cell, the cervical cells, and then slowly becomes cancerous. So while breast cancer will come with lump, most women can detect lump if you tell them how to do it. Cervical cancer is more silent in the sense that it may not be until it gets to an advanced stage. In fact, I can tell you that 80% of women present at our health facilities at a very advanced stage. Why? Because it's a silent disease, very silent. It doesn't give symptoms until very, very late. So we can say that while it's the second most common, it's perhaps first in terms of
Now let's go to the business of the day. What is the role of vaccines in cancer prevention?
When most people hear vaccines, what comes to mind are babies. They think of babies, they think of health centers, they think of nurses. And no, people don't usually think there are vaccines that adults should take, which is why it's very important for people to know, especially because in the case of cervical cancer, countries where the uptake of HPV vaccination is very high are also countries where we have low rates of the cancers. So it is very important then for every woman to be informed of first the cancer, the effect, and that there is protection by taking a vaccine that's just in 3 doses, and then you are covered. Because in that vaccine we have strains, HPV 16 and 18 in Cervarix, 6, 11, 16, 18 in Gardasil. And those are the cancer causing strains. when it comes to Africa, they're the ones that usually cause cancer in Africa.
Okay. Okay, doctor, can you please take us through the types of vaccines available? Because I learned some vaccines are produced or manufactured to treat cancer, while some are produced to protect against viruses that cause cancer.
An existing cancer, someone who already has cancer, and vaccines, oftentimes, I would say is more experimental. The person has cancer and they know that they can take some part of the person's cells, try to make a vaccine out of that. Because vaccines are usually antigens. Try to make vaccine out of that, introduce into the system of the person, and hope that the body will generate a sort of antibody against that cancer. So, so that is something that is tailored to individuals, and it's more of experimental, like I said before. But in the other way, we are trying to prevent this time around. We don't want this person to come down with cancer. And that one is very good for the population, not only for individuals now. The population, and that is where HPV vaccines and maybe hepatitis B vaccine come in. Because in this case, HPV, like I said before, human papilloma virus, this vaccine protects against those strains, 16, 18, 6, 11 that I mentioned. And then when they protect against those strains, then they prevent infection with those viruses.
Okay.
And by so doing, if there is no infection, then the likelihood of growing into cancer is kind of nullified. So that is the difference. This is proven. Take the vaccine, you are protected. But the other one is more experimental. The other one is individualized. This is general. Every woman can and should benefit from that.
Okay, doctor, what age can the vaccines be administered? A friend said at the age of 45, she approached a healthcare provider, but she was advised that she had outgrown the age.
There are two categories of people that take the vaccines. We have girls who are not yet exposed sexually, because HPV is sexually transmitted in most cases. So because they are not exposed, we want to give the vaccine to prevent exposure, so to speak. For those ones from 9 years and above, they can take the vaccine, which is why many school programs are ongoing, are in fact encouraged to kill this cancer in these girls before they get exposed to it. So for those kind of sexual exposure, we are looking at 9 years to 26. It's advisable that you give the vaccine at that time. However, even for women who are already at their reproductive ages, they still benefit up to 65 years. And the advice here is that vaccinate, then screen.
Okay.
We
for
advise
women
that
above
for women,
26 years.
yes, vaccinate, then screen. The reason why they say that is that the strains of HPV in those vaccines will protect against almost 80 to 90% of cancer-causing viruses. So we are now saying the rare strains, the 10% that are not in the existing vaccine, should still be screened against, which is why we also advise women that screen and vaccinate, or even vaccinate before screening. No harm, no side effect. So a 40-year-old woman, according to the question, should screen and vaccinate.
Okay, doctor, what is the probability of being infected after vaccination?
Well, it is the current research shows that when you take, it's a relatively new vaccine, that when you take the HPV vaccine, you are protected. for life. That's the current thing, because there has been no research that shows that we must revaccinate. No. You take the 3 doses. First, a month after, 5 months after, within a 6-month period, you complete your dosage, and then you are good to go. So what you now do is to screen. So the question is, why should I keep screening when I'm already vaccinated? Those 10% I mentioned, the very rare cases that are not so common in Africa, that are just, okay, keep screening. It's still advisable.
Okay, how affordable and accessible are these vaccines?
They are not as cheap as the other common vaccines because they are not subsidized. Let me put that way. Government currently hasn't put that vaccine in the national immunization program. So it is, let's look at it this way. We can say that to take 3 doses of cervical vaccine is generally in the region of 30,000, a little below, a little above. However, a single dose of radiotherapy or any other measure, when the cancer is established, can run into millions. So when you compare that, you could say that it's very, very cheap. It's very cheap.
Oftentimes after immunization, people go down with high temperature, some side effects. Can you please take us through possible reactions and contraindications?
Most medications have side effects, including paracetamol. So, and for most vaccines, there are mild reactions, self-limiting. You got a vaccine, pain at that side, minor swelling, maybe fever, post-vaccination. Those are reactions that will clear in the next 24 hours or so. And for Cervarix, the fever aspect is not so pronounced. I can say that because I've been involved in thousands of other vaccinations, and I can tell you that the reaction that we have seen so far is limited to pain, redness, itching, and it will limit itself within 24 to 48 hours. So they are relatively safe vaccines.
Okay, it's the 21st century. Are we ready in Nigeria to produce our own vaccines?
Well, wherever there is a will, there is a way. The probability of producing that vaccine in Nigeria is not zero. In fact, it's high. If you remember, you recall, we used to produce yellow fever vaccine in Nigeria. In fact, Nigeria was like the hub where it was produced then in Yaba. So, and I know that government is currently making efforts towards reviving that center. If they do that, what it means is that we will go back to producing those common vaccines, and then we can now go to vaccines like HPV. You can't rule it out. We only need to be determined to do it, and it can be done.
The theme for this year's campaign is I am, I will, with a call for personal commitment to reduce the scourge of cancer in the world. What's your take on this, and how can you adopt or how can you adapt this to a lifestyle?
It's a statement that's showing self-will, determination, that I'm supposed to do this, I'm capable of doing it, and I'm going to do it. So I agree that people should be educated, people should be informed, and people should be enabled to be able to prevent cancers. You know, in this setting, it's generally known as resource poor environment in the medical world. So the resources to treat cancers are not there. So the best bet for us on this side of the world is to prevent it. So the thing should be accepted, should be followed, and then should be used as a leverage by every stakeholders, government, medical practitioners, and even people themselves, to ensure that vaccine preventable cancers and cancer generally are gotten rid of.
Okay, how can this thing be adapted to our lifestyle?
Yes, our lifestyle is it's a merry lifestyle. Let me put it that way. We want to have fun and enjoy ourselves, and we hardly go to the hospital except we are sick. So we need to now adapt a lifestyle which now puts more emphasis on prevention as being better than cure. As has been said, an ounce of prevention is worth a pound of cure. So we need to spend the ounce to prevent the pound. And so it's cheaper, it's more convenient, and then of course it's better for everyone, including other family members, to prevent diseases. So we can just adapt it to our lifestyle, starting from what we eat, our environment where we live, and then we now make a conscious effort that there's a vaccine against cervical cancer. Cervical cancer is second most common cancer.
Okay, doctor, as we wrap up this segment, what is your final word to viewers at home regarding cancer prevention?
Vaccination generally is advisable. Through vaccination, the world has gotten rid of diseases like smallpox, and polio is also on the way out. So it is good, it protects not just the individual, but everyone around the individual. So vaccines generally are good, they are available for adults and children. And as for those that protect against cancer, you can't spend anything more economical than to ensure that you spend a few thousands to protect yourself from having to spend millions of naira. So concerning HPV vaccine, every woman should be aware, every woman should be informed, every woman should screen, every woman should vaccinate.
All right, thank you so much, Dr. Talabi, for giving your perspective on vaccination and cancer.
Thank you. Let me say as a final word that concerning vaccination, everyone should see vaccination as a gift in the sense that it's one way, is the most economical way to remain healthy without having to spend so much. Vaccines generally are known to have done the world plenty of good if you consider that we have been able to eradicate diseases like smallpox, and polio is also going out of the way. So we are all advised to adopt vaccination for those things that vaccines can prevent. And concerning vaccines that can protect against cancer, we want people to take these vaccines, and as related to HPV for women, we want every woman to be aware of this life-saving vaccine, every woman to screen, and every woman to vaccinate, so that together we can eradicate these cancers. Also add that aside HPV, there are other vaccines that are also protective for other cancers. For instance, hepatitis B is a very common virus, silent like HPV, and it is known that majority of people with complications of chronic hepatitis B, like liver cancer, are also found to have had hepatitis B. So it is advisable that people who have not been vaccinated also take hepatitis B vaccine towards avoiding prolonged, chronic complications such as liver cirrhosis and primarily liver carcinoma.
Prevention, they say, is better than cure. A shot of this vaccine will protect you from the burden of cancer. That ends Sound Health this week. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.